Electrocorticography. Electrocorticography, ECOG, or intracranial electroencephalography, IEEG, is a type of electrophysiological monitoring that uses electrodes placed directly on the exposed surface of the brain to record electrical activity from the cerebral cortex. Craniotomy with elevation of bone flap, for excision or coagulation of choroid plexus. The physician excises or destroys the choroid plexus. The choroid plexus produces spinal fluid. The physician cuts and retracts the scalp in the affected region. A bone flap is raised and tissues are dissected to the ventricle where the affected choroid plexus is located. The choroid plexus is resected, or destroyed using electrocautery. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniotomy with elevation of bone flap, for excision of craniopharyngioma. Craniopharyngiomas are brain tumors that usually develop near the pituitary gland and hypothalamus. The physician cuts and retracts the frontal scalp and raises a bone flap. The tissues are dissected to the sella turcica, and the craniopharyngioma is resected. The bone is replaced and fastened. The scalp is anastomosed and sutured in layers. Craniotomy with elevation of bone flap, for transection of corpus callosum. The physician cuts the fibers within the corpus callosum or removes all or part of a brain hemisphere. Craniotomy with elevation of bone flap, for partial or subtotal, functional, hemispherectomy. Craniotomy with elevation of bone flap, for selective amygdalohippocampectomy. Excision is limited to the anterior hippocampus, amygdala, and parahippocampal gyrus and preserves the fusiform gyrus and the lateral temporal lobe. MRI is done before surgery to map the margins of the involved brain structures. A brain retractor is inserted and cerebrospinal fluid is suctioned from the ambient cistern. The uncus is elevated with the retractor and the anatomical positioning of the related structures, fusiform and parahippocampal gyri, uncus, ambient cistern, and tentorium, is examined. Landmarks for cortical incisions are identified, such as the oculomotor nerve. Cortical incisions are made and the temporal horn of the lateral ventricle is exposed, using careful suction dissection of the cortex and white matter. The horn is opened and the amygdala and hippocampus are identified. The parahippocampal gyrus is now incised, exposing the posterior aspect of the temporal horn and anterior hippocampus. The thin layer of neural tissue connecting the hippocampus and the amygdala is divided with subpial aspiration. The parahippocampal gyrus is removed subpially, the hippocampus is divided transversely, and anterior choroidal and posterior cerebral arteries are coagulated and divided. The hippocampus is completely separated from the arachnoid membrane and removed. The amygdala facing the temporal horn is excised with an ultrasonic aspirator. Closure is done by suturing the dura and replacing the bone flap into position. Screws or plates are placed to secure the bone flap to surrounding skull bone. The divided muscles are sutured and the galea and the scalp are closed.